Hello, my name is Shannonsozzi, and I am recording my fourth reflective journal entry. What goals did I set for myself at the beginning of the semester, and did I achieve them? The goals that I set for myself this semester were to become more familiar with patients, the psychiatric diagnosis, the medications used for treatment, and to be more comfortable with interviewing patients. Throughout the semester with my clinical preceptor, we saw many patients with various illnesses, and I was able to assist and co-treat with my preceptor, also learning as I went along. I'm a hands-on learner, so this was a good experience for me, and it's been valuable to my education. I believe that if I have at least met these goals, but I will continue to become more comfortable and proficient as I work in the field and gain more experience. My preceptor's favorite mental illness to diagnose and treat is bipolar. So it seems that we saw more bipolar patients. I believe after this clinical placement and my experience with her that I have become more adept at diagnosing bipolar patients and treating them, picking which atypical antipsychotics would be appropriate for them. Also, I believe now that there are more patients with a diagnosis of bipolar or schizoaffective disorder, bipolar type, than I thought prior to going into this clinical experience. The second question is, what feelings, prejudice, and biases did I experience during my clinical experience, and how did I manage them? My clinical was in a free clinic, and therefore we had many poor patients that could not afford to pay for services. In this population, there were a very high number of patients with trying to get disability benefits. The reasons varied from one patient talked about losing her boyfriend that supported her, and now she needed an income, to other patients that really were trying to work and couldn't work with their mental illnesses. But and some even lost their jobs. Some of my feelings were I felt pretty irritated and disgusted by the patients that were trying to use the system and not really appropriate for disability benefits, while other people truly suffered and truly needed the benefits. But I see this as well in urgent care. So that's really nothing new. It's just more so in psych. As a healthcare